You're listening to the GLP-1 Studio Podcast.
Hi, I'm Amanda Bonello, host of the GLP-1 Studio Podcast, formerly known as the GLP-1 Collective Podcast. Today, I'm sharing a super special interview with Dr. Angela Tran. She is a board-certified obesity medicine specialist and the founder of MedFit Medical Weight Loss. She has been doing this work for over 10 years, and honestly, she takes holistic care to a whole nother level. The compassion that she brings is palpable. She's the kind of doctor that wants to crawl down into the trenches with you and help you figure it out in the way that best helps you. We talk all about food noise and weight loss with or without medication. It was an honor to interview with her, and I hope that you learned something valuable. I know I did. Make sure that you stick around to the end for some important announcements, and thank you for being here.
I found you on Instagram back when I first started my own journey, and I saw you on at least one television show, right?
I've been a local guest on the news, yes. For like a whole year, so it was a lot of fun.
Amazing. Well, you're a GLP-1 patient yourself.
Actually not. So that's actually the funny thing. I've sort of posted I prescribe GLP-1 every day, but I will never be a patient. Why? Well, it didn't exist when I needed it. But then also I'm here to also pave the way to show women you can be healthy with or without it. So yeah. So, but believe me, I don't need it now. But back in the day when I gained 40 pounds, with pregnancy and had gestational diabetes, and it would be a life. For sure.
Well, okay, so you are an advocate for GLP-1 use, and you're also an advocate for just well-rounded health in general, even without the use of medication. First, let's start with who you are and what you do.
Okay. Yeah, I'm Dr. Angela, one of the very few with over 10 years of experience as an obesity medicine doctor. So I feel like this has been my stage to help women and men, but particularly my favorite, the females in their 40s or 50s, marriage, kids, hormones galore, really stuck in the yo-yo dieting only to find out that, hey, poof, there actually is a fairy godmother. But I say that in a very serious way, that we actually have true treatment for a problem that they've been struggling for years.
Yeah. After your baby, you were able to lose weight. And it's been a while now. You've been able to maintain it, and you look fantastic. And this was without medication at all.
Yeah, I mean, just to let everybody know, I am an older mom, so you can appreciate that. I was turning 37 when I had my daughter, Haley, and I was nauseated 24/7 throughout my first trimester. All of the women out there can really relate. And Wheat Thins was my middle name. So it'd probably take me like 2 hours to get through it. And I kid you not, it's kind of embarrassing, but I would call my mom and I'd say, can you go to the grocery store, grab me some more Wheat Thins? Because that was the only thing that made the nausea sort of maintainable. But I gained a lot of weight, and I also had gestational diabetes and thyroid problems. And I'm only 5'1". So 40 pounds, 5'1" body, oh my goodness, what am I going to do now? I did not lose weight through breastfeeding like all of the other lucky women out there. And so just had to do the traditional, how do you even be on a nutrition plan when you're up at 2, breastfeeding, don't even have your head on straight. And I own my own practice. So I was still working. So I didn't really have a maternity leave. But thankfully, it was just the good old, just stay consistent, eat right, exercise when you can. And then 2 years later, I tore my ACL. Congratulations, Dr. Tran. Way to go for just doing a simple lunge in the backyard with my daughter, and couldn't bear weight. So then that took about 6 to 10 months of physical therapy. But at the same time, it just really helped me learn the muscle of just discipline and commitment to my health. But believe me, if I had access to GLP-1 10 years ago, I would have said ASAP, because it wasn't a weight issue. I was very scared about the gestational diabetes. What's it doing for my body? Everybody on my mom's side has had a stroke of some sort. I mean, what does that mean for me down the road? And now I'm just here to teach women there's so many different ways to lose weight, and there are advantages to using medical tools, but you can also do it naturally, but you have to learn the science behind it. So I'm just here to give women hope. Stop struggling. Stop accepting that you're just going to be overweight. Stop saying that you're never going to see your high school jeans. Guess what? We work together, we can get you back to being you. And that's really my joy in what I do.
I am so glad that I have someone on this show who is an advocate for treatment in general. It's interesting to see it from the other perspective. So you've never been on a GLP-1, you have lost weight and maintained, and your profession as an obesity specialist is to help people lose weight and maintain, correct?
Yes. My best analogy, and for your listeners who probably struggle with, am I doing this to just cheat my way through? That's probably one of the biggest obstacles I hear. And I always say, well, do you claim that your girlfriends who had to go through fertility treatments to cheat their way to becoming pregnant? And logically, you say, of course not. I'm like, well, it's the same scenario. As we get older, we do have dysfunction metabolically that literally I say you could be on the Survivor show and eat bugs and still not lose weight if you had, problems with, hormones and, things like that. So please, if there's one message, please change that belief system that is not a cheat mechanism, and that the opposite, it literally could change your life. And raise your hand because I'm ready for you.
It's been life-changing for me. It's been life-changing for so many people. So it is refreshing to hear that from someone who's not on the medication themselves. Thank you for advocating for those that need it. And I love that idea that you could liken it to a fertility treatment, because no one would ever judge people for using a fertility treatment if they couldn't get pregnant. That would be heinous. And the same should be true for using a medication when your hormones are messed up to help them get in line, right? So I must know, how did you do it?
It I I wish I could say it was easy. I just tell people it's not easy, but that's a good thing because I'm here to be above average. The real secret to all of this, and this is what I teach, everybody can get access to the magical diet plan and the exercise, your go-to fad diet of the month kind of a thing. The reality is that you have to change your identity in how you see yourself. And I knew, especially in my particular field, I needed to be congruent with the message that I am passing on. I just didn't feel comfortable just being a doctor, prescribing medication, good luck to you, lose weight. And I was
Yeah.
going to teach you, I feel more powerful, even with my own spirit, that I'm leading the way and modeling. But it's not easy. It's not all rainbows. I woke up this morning, had no motivation whatsoever to go downstairs and do my usual workout routine. But the trick is just that my workout clothes are already set out. I was already awake, just that one little minute of that warmth in that blanket. And I said, okay, let's go. And so I just go downstairs, and it's funny. It only takes like a few minutes to get over that hump. And then after every time, it's like, oh, goodness gracious, I'm so glad that I did it. But I tell you, it's the ongoing story. It's not like I wake up and say, hooray, it's leg day today. That's
Yes.
not me. But at the same time, it's like, oh my gosh, I felt so good after I did the workout. Now I can conquer the day. And that is what gets me going, to do the hard stuff first.
Right.
Yes. So yeah, it's just, I want to inspire people, but just tell you it's not easy.
And when you say it's not easy, are we talking about the struggle with working out? And you're absolutely right. You get that 10 minutes in, and then it's like, okay, now I'm good. I'm warmed up. I'm going to continue this workout and feel great. But starting is the
Yeah.
hardest part.
Yeah. And it's purely the mindset muscle. I mean, I could have easily just gone through the workout in a very easy way. And some people can clock in like 10 minutes of, just maybe an elliptical, but it's literally just that voice that wants to keep you safe and tricks you into being comfortable. But I'm here to accomplish, a lot of things while I'm here. And so I have to sort of kind of remind myself, okay, who am I being? It's not what I'm doing. And
Right.
that's really what this is all about. It is not the magical number on the scale. It's not the cute dress or, being comfortable in a swimsuit, which is all benefits, fantastic, but it changes me and it allows me to just be me. When I feel good about myself. So, but yeah, it's a muscle like a dumbbell that you're lifting every day. That's for sure.
Do you struggle with food noise? I'm sure that you know all about food noise and you've got lots of patients who experience it. Do you struggle daily with food noise and have you experienced that yourself?
I think that people actually would be surprised that I would say, actually, I'm hungry all the time. I don't know if I'm ever actually full. But when I say food noise, it's sort of like fear. Fear is always there. It's not going to
Mm.
go away. We all try to make it go away and we battle it and then we have arguments and then we turn into anxiety and all that stuff. But the reality is that I'll say, okay, well, fear, you're not going to go away. So how am I going to handle you? You're going to just sit in the back seat. You're just going to be like a peanut gallery. He's not listening to you. Well, there are a couple ways. There are mechanical ways and there are mindset ways, right? So, when I'm hungry, I'll be honest with you, I have like a container stacked full of sugar-free Jello. That's just like my drug of choice. So when I'm hungry, it's like, okay, this is guilt-free. I can have sugar-free Jello. Borderline sad that my last grocery visit, they didn't have it in stock. So I'm like, oh, I need to go somewhere else, so sugar-free Jello, or I always tell my patients, just get a safety net. What is safe for you to grab? Because, hey, guess what? It actually is okay to be hungry. I think people need to realize that it's actually normal and okay to be hungry. It's just how you manage it, just like fear. Okay. The second thing is that, okay, I keep in check. Okay. When did I last eat? And I'm like, literally, people are going to laugh. I literally have no idea how people can just eat 2 slices of pizza and be completely done. I'm like, like my husband, he just eats like, 2 slices or 1 burger. And I'm like, how are you just completely full? And I'm like, I probably could eat more if I wanted to, but I show restraint and it's not easy. But I say to myself, okay, well, I've already have my next meal plan timed. So believe it or not, often again, just kind of that mind playing tricks on you than the actual hunger in itself. So I've just learned to kind of be mindful of what the food noise is saying rather than making it go away, which I think is a skill to learn. But when you develop it, I think at the end of the day, just remember it's okay to be hungry.
Okay. And prior to your pregnancy, did you struggle with weight at all? Or were you
You know,
pretty?
I was 5'1". It was kind of just on the smaller side. The problem with going to med school is don't know when you're going to eat, but then when you're eating is usually like midnight in the middle of like a night shift kind of a thing. So be honest with you, it wasn't necessarily a weight thing, but I was just one of those, well, I'm just going to out exercise my bad eating habits. So I do admit that I had bad eating habits, but I would just like exercise like crazy. I think, truthfully, it was because I was still kind of young. I still think 30s was young. So I still had a in check metabolism. But if I had the same lifestyle post pregnancy or now that I'm in my 40s, following those habits, 100%, I would have gained the freshman 15 year after year with the lifestyle that I had back then.
And so when you say that food noise is like the fear of being hungry that's always there and that you are always hungry, do you think it's possible that your hormones are not the same as someone who suffers from the disease of obesity and what they experience when they call it food noise? Do you think it's possible that what you're experiencing as being hungry is different than that.
Oh, 100%. Again, this is all chemistry driven. I mean, it's just the same. It's like all women can get pregnant and will have all different experiences. I have girlfriends who I had the pregnancy glow all 9 months. I don't know what you guys are talking about. And then I was like, nauseated and just like, good God, I don't know if I'm going to make it the next, couple trimesters type of thing. And it's just all chemistry. But I also knew because of the hormones with pregnancy and then just kind of the blood sugar, I was actually never a sweets person prior to pregnancy. And then all of a sudden, that was just the only thing that I could survive on. So I really, really, I've used this analogy also for patients. You can be a safe driver. You can look left and right. You can wear your seatbelt and go the speed limit, but you're not going anywhere. Smoke's coming out of your car.
Yeah.
So please know the takeaway message is that there's a lot of chemistry, not just from the gut, but from the brain, which beauty of fast forward to the GLP-1 magic of what this does. I mean, and we're just at the start. There's going to be more coming that's going to make Ozempic look like the first season of Real Housewives. We don't even know the original cast anymore, because the new ones are just going to be like, ooh, who are these? And I tell you, it's exciting. But again, it's because we finally have advanced scientific research to show, the connections. And if you understand that, then there's so much goodness ahead.
So my mother is a type 2 diabetic, and she does not feel comfortable using GLP-1s. I believe it's because it's an injection. Sure. She fully supports my work, but
Sure.
she's afraid of the needles. She's not comfortable with it. What would you suggest for someone and she does struggle with food noise? And I believe that the food noise that she struggles with is akin to my own, which is just impossible to control. Just a lifetime of trying to control it and absolutely torturing myself when I was not able to. What would you tell someone in that situation who did not want to use a GLP-1, but they needed to lose weight because of medical issues?
Yeah. The first question is what is that food noise saying? Are you hungry? Or is the food noise saying you're not good enough? Is the food noise saying, what's wrong with you? Is the food noises, aha, you and I are going to be best friends. Go ahead and have ice cream. Or is the food noise, just have a mind of its own? It's like, I'm not going anywhere. There's a lot of struggle behind that. And I totally I'm actually not a needles person. I think people would be surprised that I hate flu shots. I can perform surgery and I can do anything on other people, but I turn into a white ghost when something happens to me from a needles wise. So I respect that, but tell your mom good news. There's a pill version on the way. So just hang tight, kind of thing. But I would even from that perspective, instead of being very judgmental, change that into curiosity. Like, what is it about the injection? Is it really because it is painful, or is it telling you a different story? So this is a lot, a deeper level conversation, but I really remind people that food noise ends up actually being an in-depth story, and we uncover it chapter by chapter in lots to read in novel, fashion. But that's reality. But the cool part about it is that there is still chemistry involved. But when you sort of shutter the food noise, then you say, aha, the food noise doesn't get to win today. That's what the medication gets to do. It doesn't shut off the food noise. It basically kind of wakes you up to say, aha, you don't get to tell me that I'm not enough today. And so I'm going to go back to doing what I was supposed to do.
Yeah. And so for someone who struggles with really bad food noise and they don't want to use a GLP-1, is it your suggestion that they get therapy?
There's multiple ways. I am all about whatever is accessible, whether it is true Western medicine, therapy, psychology, things like that. But I'm also into meditation, acupuncture. I've really also been getting into the spiritual realm. Is your belief system, even just that part of our, what I believe, just energetic beings, the psychic realm, for those of you out there, Lionsgate portal galore, the next couple of weeks, I am all about accessible to what you believe in. I truly believe there's a lot more to it than just this like cellular, chemistry in 7th grade kind of thing.
Yeah.
But it does take the first step of recognizing, wow, the food noise is not because I'm lazy and I overeat, which is never true, right? It's because someone in my childhood told me something that made me uncomfortable, whether I was overweight or you're already on a diet at the age of 5. Traumatic events that likes to pitch a tent in your subconscious. But the good news is that when you really start to understand yourself, then this really becomes a journey beyond just literally eating right and exercising.
Well, first, I want to say so, what you're expressing is personalized treatment that goes beyond just including your average system, full system care like nutritionist, health coach, fitness trainer, mental therapy on top of whatever habit training that you're doing. But you're talking about going so far as to meditation, acupuncture, and spirituality, which I believe does hold a certain amount of power over your brain, right? If you are a spiritual person, that can be very powerful. It can be a very powerful tool for you. So I think that that's a beautiful concept to not just, to not just heal the whole person with all of the healthcare tools that you have, but to go so far as to whatever they need to make their journey feel whole and help them heal all the way through, even spiritually. That's amazing.
Yeah. I mean, a lot of my patients just come up to me and say, Dr. Tran, what do I need to change? I say, you don't need to change anything. You need to let go. All those layers that you keep putting on yourself with all of the, events that appeared negative to you that put you into hiding. I'm here to help you that there's nothing wrong with you, but we've just been trained to hide and protect ourselves, which makes sense. But there's nothing you need to change other than uncover the layers that you've been holding all these years.
I do believe that there is an important piece to mental health when it comes to, especially for someone who has been struggling with their weight their whole life. I think that there are a lot of challenges that life presents and the way that society can sometimes treat you, and that it always ends up with this person at any stage in their life needing some emotional support, some mental support, and to do some of that unveiling, as you stated, like of themselves, learning more about themselves and how they can move forward and be more confident and feel fulfilled. What you're describing when you say that some of this comes from like trauma in your past, it sounds like emotional eating.
Yes.
And do you believe that it's possible for someone to have food noise and binge eat and still have had that mental work and feel good there and still not have that control?
Again, this is such a great question because it's all about identity. There is crossover, obviously, as you can imagine that there is some emotional eating, and then there are some who say they binge eat, but then there's also like sort of the actual clinical disorder, binge eating, kind of thing. And so it takes a real deep work of just, you are not a binge eater, you just have binge eating. And so that's step one, to separate yourself out. Again, it's sort of kind of back to the analogy of like, why would you say you are a dangerous driver if smoke's coming out of your car? There. I mean, you're a safe driver. And I'm telling you, we logically think, oh yeah, but until they have a conversation with me, again, chemistry is involved that is giving you a signal that is really hard to avoid. And unfortunately, we developed the habit of the binge eating. But when you sort of kind of wake up, it's like, okay, let's fix the mechanics and give you just that mini pause, enough to say, wait a second, no, I am not a binge eater. I am a healthy person. So what do I need to do to reroute to this? And believe it or not, it's not easy, right? But it's
Right.
sort of like me waking up. I'm a healthy person. So it's just like, I need a little pause. I'm convincing myself, okay, I need to just stay in bed because it's just warm and I'm so tired, blah, blah, blah. Or, you know what? Okay, so, okay, stop 1 second. Okay, what do you really want? It's like, oh my gosh, I really want to look good in my leggings. I want to feel good about, my exercise. It's like, okay, I'm going to jump out of bed, not even think about it and go downstairs. Then eventually it just becomes a habit. Again, the distinguishment is that we got to stop and say, let's not identify with our problems.
Yeah, I like that.
So that's the sort of the secret of all of this is that GLP-1 gives you that pause. And it's not the magic. You are the magic. You just didn't have that pause because you negated the pause for 1,000 years. So the cool part is that the GLP-1 is not actually the fix of the food noise. It actually allows you to address it because you ignored the pause. And then all of a sudden, when you hear that food noise, want to grab something and it's like GLP-1 kicks in. "Ah, I'm not even craving it. I'm just going to go back and go to my reading." And then you do that the next night and the next night. And then you say, oh my gosh, I don't remember the last time that I ate something sweet before bedtime. And then you embrace this new identity. Wow. This is what normal people feel like, kind of thing. So that's really what we want to learn about this, I call bumper lane,
Right.
opportunity to teach you
I-
to be, a really cool, healthy person.
Oprah said, wow, this is what real or normal people feel like. And she got a lot of clapback from, I don't know, I guess people who were thin but still struggled with food noise. And I will say, I think almost every single one of us in the GLP-1 community has had that experience where it's like, wow, this is what normal people feel like. This is me.
Yes, yes. And then you just realize, wow, maybe I'm just not that weird, crazy, obese person, that I called myself. And again, it really is a true, exploration and self-discovery of like, oh, cool, this was actually just a fake, outfit I was wearing the whole time, so, and again, this is really, really deep conversations. Please know that these unfortunately don't get cured overnight, but
Yeah.
here to help patients understand that there's nothing wrong with you, and if you just understand the real work behind just, okay, cool. So how do I bring the best version of myself and what are the tools I can take advantage of? That's really what this is all about.
I really like your analogy of the car. So you just said there's nothing wrong with you. And I'm thinking there's something wrong with the car though.
Yeah.
And that needs to be fixed. I love that you said you're not a dangerous driver just because your car is smoking. That doesn't make you a bad driver. You just need to get the tools out to fix your car. And those tools are anything that work for you, essentially,
Yeah.
because every person is different.
Yes. But think
I
about
like-
people who are blaming the driver.
Yeah.
Blaming the driver and then other people are honking. You're like, I can't fix the smoke, but we feel bad because we can't move, so then we just sort of operate in that. That's the same way, so let's kind of change the perspective here.
Yeah, I like that. I also definitely agree with not identifying with our problems. I think that a lot of people, they consider themselves obese or fat. And I think that it's been eye-opening for those who have suffered with the disease of obesity to stop identifying as obese and start calling it what it is, a disease. Have obesity. I am not obesity. So I like that idea. We don't want to identify with our problems. We need to distinguish ourselves separately and take care of that person.
Yeah, and here's the challenge. I'm going to be truthful here. You need to work with someone who believes the same. And unfortunately, you will run into people who identify you as obese. And then you wonder, why am I not losing weight or not successful? Because you need to work with someone who already believes in you in the first place. And it's the same with, and don't get me wrong, I've got many colleagues who, responsibly prescribe medication or whatnot. But if there is still an incongruence in belief, you're going to run into trouble. Because that doctor and say, hey, you eat too much and you exercise, here's a prescription. That person is going to have a different success route versus someone who said, get you.
Yeah.
Wonder you have had trouble because, your grandmother just basically paid you to be on a diet. There just is like a little bit of an understanding that needs to have just, again, a congruence. And I tell you, that's going to make a big difference in your own success by having someone believe in the same beliefs that you do.
Yes. So It's funny because you said that essentially you don't want a doctor that's just going to say, you need to lose weight, here's a prescription.
Mhm.
And I think most of us, until maybe recently, I think most of us have experienced the opposite spectrum of that, where we get the doctor who says, just eat less and move more, which
Mhm.
I think historically that's the most common. I definitely agree that you need a doctor who wants to see you succeed and be healthy and just be the best version of whoever you want to be. I don't believe that pushing them out the door with a prescription without actually helping them get to the root cause is the answer. And I know that doctors have gotten a lot of flack in the past for not having more experience with nutrition, but
Mhm.
that's not their job.
Right.
There's nutritionists and dietitians for that. That's their job. And I definitely like the idea of helping the patient find out what areas they need help with rather than here's your prescription, here's your piece of paper that says how to exercise and
Yeah.
bye, go
Yes.
do it.
Yes, yes. And you're right, I didn't go to medical school learning about nutrition and things like that. And here's the giveaway. I don't expect doctors to do it all and do the nutrition, but the difference between just a standard doctor and the really good doctor is just asking more questions. What does your support system look like? Do you need my help in finding a nutritionist that maybe we feel comfortable that will help? What's your plan for your exercise? Again, you do not need to go get a degree to know how to ask questions.
Yeah.
That's kind of like a good sort of radar on who truly is an advocate for your success, not just giving you the medication versus, take this, take 2 Tylenol, call me in the morning.
Yeah, I love that. Asking more questions. I think that you're absolutely right. Not only if you're curious, not only do you learn more about your patient, but you also can take that curiosity and learn more about different things that can help that patient. And it's just going to be forever evolving because science is always changing. So the more curious you are as a physician, I imagine the better you would be at being a physician.
Yeah, yeah, it's just like, I don't claim to have all the answers, but I'll tell you, if I don't know the answer, I'll help you find the answer. The door is never closed for me. And so that's how I operate. So fine, if someone says no, I'm going somewhere else. Sometimes I think I'm unique when someone just hops on a phone call with me for the first time. Obviously I have a presence on social media and things like that, but be honest with you, I'm a little small barking dog. Kind of, I know what I want. I tend to get what I want, and I'm stubborn, and I won't stop until I get it. And unfortunately, that's sort of actually what has made me successful in healthcare because it's so messy.
Mm.
But the good news is that I've never seen a closed door, and that's how I live. So I say, fine, if you're not going to help me, I'm going somewhere else. I'm not going to
Yeah.
accept, no.
Well, and this leads me to my next question. How would you suggest that patients advocate for themselves when it comes to their healthcare provider?
Yeah, gosh, that's a great question. I say this all the time. I really have sympathy for those who don't have any friends or family in the medical field. And I make this joke that the only reason to go to medical school is because I have friends who are doctors, so we can ask questions kind of thing. At the end of the day, I always just say, you are still ultimately the decision maker. And you just need the right information. And if the information doesn't seem right to you, then take ownership of that and get a second opinion or a third opinion, or just definitely just understand, do you have what you need to feel comfortable of what you're doing? And sad to say, even just as like I take care of my family members and they have their own providers. And sometimes, we take their information. And I was like, no, maybe let's go ask this person instead. And I don't mean to step on anybody's toes, but for sure, yes, you definitely need to be an advocate for yourself, but let's be real. It's really hard because you're lost and you don't know, what to do and you feel paralyzed. So the second solution is, okay, find someone in the medical field that you trust that can help guide you. So sometimes I do proudly offer myself as a second opinion to my patients. So it's not just always weight loss, and I
Nice.
care about gosh, if you're seeing, the kidney specialist, let me know, what the discussion was and let me just help you understand. I don't interfere with any decisions, but again, as you know, doctors sometimes don't slow down to explain in English
Mhm.
what's going on. So, I mean, even just walking my mother through like her health problems and things like that, the usual, I hate to say it, the nod, the smile, I get it, I get it. And then she leaves the room and is like, okay, what did the doctor say? And I'm like, were you not there?
Oh, yeah.
We just pretend that we, understood what the doctor said. But, and then again, half the battle is just knowledge and education. So I'm happy to use that actually as a skill set to help people, especially in the GLP-1 world. Hey, guess what? I'm not going to prescribe it to you until you actually know what it does.
Yeah, seriously, thank you. Because a lot of people have been given this medication without any clear guidance, and then they suffer with side effects. And the side effects can be pretty severe if you don't know how to manage them. And unfortunately, the education has not caught up with a lot of the healthcare system, and they don't know how to guide patients on how to do that. I was just interviewing Justin Silvers from SymptoGuard, and he was talking about how a lot of these healthcare providers will send a patient's prescription out with some anti-nausea medication. And I thought that that was a very interesting point. Before the patient even has any symptoms, they just send that out there. And it's like a really strong one, a really strong one. I never experienced nausea. When I was given my prescription, I also did have a prescription for the anti-nausea medication go with it. And I was like, I'm not going to take this. I don't even know if I need it yet. I'm not going to take this. I'm not going to waste my money on paying for the prescription, first of all. But second of all, I'm not going to take something that I don't even know that I need. I don't need extra medications. So yeah, it's definitely important to find someone who has education in the area. And that's true for even if you're not using a GLP-1, but if you're asking for guidance on something like fitness and nutrition, if they don't have those answers, and that's fine, if they could give you resources or send you to someone or refer you to someone, then I think that that's a really good start.
Absolutely. And, typically what we do is we like to just practice mapping out 2 steps ahead of you at all times. So it's one thing to prescribe the medication, but, with every patient, here's what to expect. Magical words that don't get spoken often. So this is what's going to happen at month 1 and then month 2, month 3, type of things. This is what you do if you experience this. But then also sort of kind of like the fun milestones. I even had a patient who said, Dr. Tran, I had to get my glasses adjusted because I lost weight and my glasses didn't fit my face anymore. And then I have like other women, it's like, oh my goodness, I had to go back to the bra store and get refitted. I had no idea, so it's just sort of kind of fun. But just because we just had so much experience, we just like, okay, this is what happens like the first night, and then you're going to go through this. And I'll even say, let me know when someone actually tells you you're skinny.
Oh,
You do. Now there's actually twofold to that. The one side of things like fantastic, doing a great job. But I always warn people, hey, tell me how you felt when someone told you you're skinny, because that can really bring a whole gamut of things
mm-hmm.
have to work through also. So that's part of like the whole management of this medication is not just the side effects, but it's just sort of like the changes around you that you don't even see. But because again, that's why we're just specialists, because that's just all we do, so that we can borderline kind of protect you, but help you play the game in a fun way.
Yeah, I like that. And I know what you mean. As a person who has gained and lost tremendous amounts of weight over and over again throughout my life, I really did not appreciate people commenting on my body or my appearance. I would rather just fold inside of myself and not be seen.
Yes, yes.
And that's at any stage. I just would rather not have eyes on me at all than hear, you lost weight. How did you do it? You look great. And it's like, God,
Yeah, and that is totally
please just,
another, that I mean, that's really part of this whole process, in a battle in itself. And so I do, work with patients through that process too. Because, yeah, you sort of kind of stay unnoticed, but you're really noticed. But then when you start to lose weight and like, okay, stop talking about me, kind of thing. Let's talk about something else that's making me nervous because it just creates this unnecessary pressure. And, so there's a lot to it, but nothing that can't be overcome, for sure.
I like that. That's a good ending to that. Nothing that can't be overcome. There's always a way through it. And if your physician does not have the answers, then there is someone who does. And it's best to get a well-rounded treatment in whatever you need, including spiritual guidance, meditation. I think meditation can be very powerful. I love that you brought that up because I don't think that I've heard too many physicians talk about meditation, but your mind is very powerful.
Yes.
I would say I personally have a difficult time believing that our minds are more powerful than our biology. That is my personal take. I think that if your hormones are sending the wrong signals to your brain, you can only fight it so much depending on, because it's a spectrum, right? And no one is just all the way one way or all the way the other way. Someone might have food noise on this scale that is lower than someone else, and maybe that person can overcome that mental challenge. But I do believe that there are some people who are higher up on this spectrum, including myself, who just absolutely suffer and are just insatiable in every capacity. And it doesn't matter how much you eat or how sick you've made yourself, that you are just never full.
Yeah, no, I completely believe it. The mind is a powerful thing, and definitely, follow a lot of those, experts out there that miracles happen every day. And yes, there's a cellular level, but there is a spiritual level, there's an emotional level. And sometimes I feel like disease is not at surface a cellular thing. Yes, it can be a component to, the emotion held that is manifesting through a physical condition. And I see it all the time and I believe in it. And it really has just, again, like I said, I'm not promoting anything other than what do you believe in that will be helpful. And there are some people who are very traditional. I just need a medicine and let me be on my way. And the other one who says, what do I need to work on myself? Okay, awesome. Let's talk about that, because the headaches are not really headaches. Let's talk about the root of what the headache is. And it's more usually a situation and not so much a receptor or some sort of disease.
Yeah. Yeah. And when you said that people sometimes just want to take their medicine and be on their way, you feel that it's important to still exercise and eat nutritiously, correct?
Well, that's the drug of
If
choice.
you're on medication.
Exercise is going to be always my number one prescription. Mind, body, and soul. Obviously, I exercise, but it is not for weight management. It is to keep me from getting crazy. It's like, I tend to be, they call it human design. I am a generator. For those of you who follow human design, I have energy up the yin yang. And I'm like probably that little kid that just needs to run around the gym, 100 times in order to kind of mellow out type of thing. But that's just like my thing, but I enjoy it. I always say energy, emotion is energy in motion. And, part of that is that, well, gosh, if you're just going to let it sit, then of course you're going to get anxiety, depression, or, mood swings and, fatigue and whatnot. Or let's address, the stagnance of that. And it doesn't always mean, no, you don't need to be a runner. You can just walk or stretch or do yoga. Or people don't realize that you just need to express that energy. Maybe you need to learn how to play the piano. Maybe you just let go of music or whatnot. So I think there's a higher level of a definition of exercise than the traditional get your heart rate up for, a certain amount of minutes. I say, let's redefine exercise. And it just means how do you keep the emotions you're carrying from being stagnant? And what is that activity? And guess what? Meditation actually requires almost zero physical activity, but it is an exercise, right?
Your brain. That's nice.
Well, so let's rethink what exercise actually means. Is sort of kind of get that emotion, that energetics back to being free again. And you do not have to be a runner in order to be, at the healthy weight that you want.
I like the idea of exercise being the first prescription, or what did you call it?
Yeah, the prescription of choice.
Yes,
Always,
the prescription of choice. I like that.
always as a doctor. It's just taking care of the basics.
And I think that exercise has a tremendous amount of power for our brains as well. It
Mhm.
helps fight depression, it increases blood flow, it increases confidence. And a lot of people who have obesity don't necessarily have the drive or even sometimes the ability to exercise in the traditional sense. But I I think what you're saying is just to find a movement that you can enjoy that works for you. And even
Mhm.
if that means that you can only move your arms, like doing something with your arms is a good start. I know some people who like to dance when they do the dishes, and
Yes.
it's still some exercise.
And I tell people, there are people who claim that they hate exercise, and I would just sort of challenge, you know, I don't know if it's the hate of exercise. What's the judgment that you're putting around exercise? Yes, it hurts if you're overweight, 100%, but that can be fixed. Yes, it feels uncomfortable going to a public place where you just don't want people to look at you, but that can be fixed. So I feel like there's kind of a judgment story around it before you say, again, I have a patient who she would just kill me if I dragged her to a weight or, some sort of like a high intensity exercise, but she absolutely loves to line dance.
Great.
Don't hate exercise silly. You just got to do what you enjoy.
Yeah.
So exercise is kind of along obesity. There's kind of this misjudgment around it. But at the end of the day, let's just not even use the word exercise. How are you moving your emotions so that it doesn't pitch a tent and become stagnant? Because it's going to cause trouble in multiple ways if you don't address it.
Yeah. Well, I love the way that you have framed everything. I like that you are an advocate for this medication, but that you see healing the whole person as the real solution and in whatever way works for them. And I really appreciate you coming here and explaining your perspective and sharing your story and posting on social media because I love following you.
I appreciate it. And again, I'm just so grateful to be a guest. And these were a lot of deep conversations, but the takeaway message is please know that you're not broken. You're definitely not alone. And you don't need to change a thing other than you need to let go whatever is holding you back. And I am fortunate to be someone who was born to help facilitate that. And that's why I'm here.
Yeah, that's beautiful. And I like letting go of whatever's holding you back because that could be anything. That could be many different things. So you're absolutely right. Keep the curiosity, dig deep, find out what it is specifically so you can target that.
Yes, absolutely. It was a true joy, and just again, hope this changed someone's life today just by hearing this.
Yeah, thank you so much. I really appreciate you. I appreciate your advocacy. I appreciate your time. You're fantastic. Thank you so much.
Thank you.
We'll see you next time.
Okay, sounds good.
Bye, Dr. Angela.
All right, thank you. I appreciate it. And again, thank you so much. I do appreciate it.
Thank you for sticking it through to the end. I am eternally grateful for the support always. Now, the podcast name. It might seem confusing that the podcast name has changed, but trust me, it was a lot more confusing when I had to explain that the GLP-1 Studio for-profit produced the GLP-1 Collective podcast that was not related to the GLP-1 Collective nonprofit. That was a mouthful. It just made sense to swap it. Now, with that important announcement aside, please join our Substack. The GLP-1 Studio Substack is going to give you all of the updates that you need to make sure that you are in the know when we have GLP-1 meetups, like the one in Atlanta, Georgia, this November for Obesity Week. You can also use the chat feature to communicate directly with me so you can ask questions if you're confused about what's coming up and find out how you can get involved. I look forward to the opportunity to get to know you all a little bit better and feel a little bit closer. If this episode moved you at all or helped you answer any questions, then please consider giving us a 5-star review and sending it to a friend. As always, I am so grateful for you being here. See you next time.
Stronger together.